I'm Dr. Tom Svinarich. I'm a cardiologist with long experience that taught me that we need better ways to prevent and heal heart disease. In this video, I'll describe the Lifespan program from Colorado Center for Functional Medicine that integrates the principles of cardiology, functional medicine, and longevity to do just that. We want to help you live well and die young at an old age. A long lifespan is good if we keep good health into older age. Most of us, if we escape injury, trauma, infection, will die from heart disease or cancer as we age. Most of us fear and dread other problems like dementia. And common causes of debility as we get older include stroke and metabolic syndrome, diabetes, arthritis, and immune disease. These are called diseases of aging because they seem to be inevitable as we grow older. Diseases of aging are called chronic progressive diseases because they persist or worsen until we die. They rarely occur in isolation, and they accumulate so that as we get older, we may have multiple chronic diseases and be on multiple medications. The problem is we're getting older sooner. Diseases of aging are occurring earlier and earlier. We often are sick for decades before we die. 50% of Americans have heart disease currently, and multiple chronic diseases and medications accumulate before we die. The prevalence of cardiovascular disease in the United States is prevalent not only among the old, where it's almost ubiquitous, but also in people in their 40s, of which about 40% of folks will have heart disease. The price we pay for diseases of aging is steep. We're robbed of vitality, comfort, sexuality, independence, mobility, social connections, self-confidence, and our money. Aging is the accumulation of injury combined with a failure to repair. It's like an old car getting rusty. But if we limit injury and maintain upkeep, we can become a classic. The Lifespan program consists of a unique program of testing to prevent aging. It's one of the most innovative and comprehensive evaluations available for the detection and prevention of heart disease, and by extension, the diseases of aging. It goes beyond early detection of existing disease. It identifies problems that will become or are aggravating disease. It identifies patterns of injury, and it can identify failure of repair. It's a holistic approach because we know that issues with gut health, microbiome health, and autoimmune system also contribute to aging. The cardiopulmonary exercise test is an example of this unique innovative testing. It measures the consumption of oxygen, the production of CO2, and the amount of ventilation during graded bicycle exercise. It's able to look at heart function and lung function and muscle function in an integrative way. This is the only test that gives an accurate measurement of cardiopulmonary fitness. Every other measurement is just an estimate or a guess. It is the best predictor of mortality, overall mortality, cardiovascular mortality, even cancer mortality. Cardiopulmonary exercise testing detects problems in large arteries just as traditional testing does, but it also detects problems in small arteries, which is an early manifestation of artery disease and the kind of problems that occur in women that may be so difficult to find. Artery health is synonymous with aging. The saying is you are only as old as your arteries. So other testing is done to look for early and subtle abnormalities in artery health. We look at endothelial function, imaging for evidence of artery blockage, looking for artery inflammation, oxidative stress, and lipid abnormalities. We also want to test gene variants that can be modified by diet or lifestyle changes. We also want to measure the expression of these genes to see if they're turned on or turned off. We know that stress and function of the hypothalamic pituitary axis is crucial for the development of diseases of aging. So we want to evaluate this, including evaluation of function of the autonomic nervous system. The circadian rhythm is crucial for maintaining health. So we want to analyze sleep quality, sleep architecture, and sleep apnea. Metabolic syndrome is one of the most common contributors to heart disease. So we measure body composition, we measure visceral adiposity, and we look for subtle abnormalities of blood sugar and insulin regulation. Nutritional deficiencies reflect either dietary problems or problems with digestion and absorption. So we look for changes in status of vitamins, minerals, amino acids, fatty acids, and other nutrients. Our health can be no better than the health of our microbiome. So we will look for problems with dysbiosis and infection. We want to make sure that those trillions of microorganisms that exist in our gut and in our mouth are in good health, because if they're not, we won't be. Problems with the gut underlie most heart disease. So we'll look for intestinal permeability, things like wheat sensitivity and other food sensitivities. Most chronic disease has an autoimmune component, so we'll be sensitive to any imbalances in autoimmune problems. We'll look for hormone balance, and we'll look for toxin exposure and the ability to detoxify. There's no meaningful investment in the future that does not include an investment in your health. Some say I exercise or I eat clean and are surprised to learn that autoimmune or hormonal problems are lurking. Others are pessimistic about their future because of a worrisome family history, but they receive hope when they can be proactive about their health because of the lifespan program. What others call preventative testing doesn't go beyond early detection of established disease. What others call preventative care does not address the root cause of injury. Others suggest that there are magical solutions to health problems, but our focus is to gain a solid understanding of your health and give attention to nutrition, diet, and lifestyle changes that make life better and healthier. If you care about protecting your health, or if diseases of aging are entering your life, the Lifespan program is for you, so we can help you to live well and die young at an old age.